Many of you know I ran for the U.S. Senate in the special primary in the summer. And while I didn't win, this is in New Jersey, I got name recognition. A team came together and said, why don't you run for Congress? And it was in a district where the incumbent has been there for 14 years, is a Democrat, thinks Obamacare is wonderful, except it didn't go quite far enough. He wants single payer. So I thought I would like to run against him. Most of the people in the Republican Party said, forget it, he's unbeatable. So I was the only one that stepped up to the plate. And a team came behind me. We started to get support, and by the end of March, I had over $100,000, which was considered major for, to be considered a serious candidate. The reason why I was running was we started a non-government free clinic, and we care for the poor at the cost of only $13 per patient visit. When the government does it, it's 10 times more, and it's not adequate. And yes, people are referred by the Medicaid office to our clinic because they can get access to care. It's hugely efficient. And we're trying to pass a law where if people would donate 4 hours a week, in our clinic like ours, they would get malpractice protection in their private practices. It's something that would really work, and I think we could kind of dismantle the Medicaid program. We had a patient who had broken her leg, and there's a story is in your packet of her. Medicaid really failed her. She broke it 3 years ago, and it was never repaired. The doctor would have only gotten maybe $400, have full liability, so they always said, oh, somebody else has got to do it. There she was, and the Medicaid kicked her out of the hospital, constantly back and forth. Finally, we found a doctor and said, look, would you just fix her leg and we'll pay you? Our clinic paid him. So it was a local doctor finding a local doctor in a local hospital, a local charity. We didn't need permission from Washington, D.C. Well, I would like to go to Washington, D.C. to get the federal government out of health care and block grant all that money back to the states, let them figure out how to do it in a much more efficient way. Here's how I could win, and I would like to be your representative in Washington. And again, it's funding. You can all obviously donate to the campaign, but each of you is in a specialty that has a PAC in DC. So I'd like you to all give me your card and contact information. I will send you the email and the phone number of the person who runs the PAC. And then you can just contact them and say, hey, would you please donate on behalf of Dr. Eck? I would like to see her get into Congress. And that would make a big difference. And then I have a phenomenal team together that's going to make this happen. I think we can win. And you get a doctor down there that understands healthcare. There's only 17 doctors in Washington right now, and obviously they didn't have enough gravitas to change what they have done to us and our patients. So what we need to do is reverse a lot of that, repeal Obamacare, and we need to just come up with a much better system to care for the poor. So I ask for your help. Just give me your cards, and I'll contact you on how to help me, and that would make a difference. Thanks so much.